Have you ever sat in the bathroom feeling like your body is trying to go, but nothing happens? Minutes pass. You strain, wait, try again, and eventually walk away uncomfortable, frustrated, and exhausted. Most people call this constipation, but sometimes it is something far more serious quietly building inside the body. As we age, the digestive system changes in ways many people never expect. The muscles that move waste through the colon slow down. The body absorbs more water from stool. Medications, reduced movement, low hydration, and even stress can gradually create the perfect conditions for stool to harden deep inside the rectum until it becomes extremely difficult to pass naturally. And here is the dangerous part. Many older adults ignore the early warning signs for days or even weeks. They assume it will eventually resolve on its own. But over time, pressure builds inside the lower digestive tract, creating discomfort, bloating, exhaustion, and sometimes symptoms that seem completely unrelated. In today's video, we are going to talk honestly about what really happens when stool becomes trapped in the rectum, why this problem becomes much more common after 60, the warning signs most people miss, and the safest step-by-step ways to respond before the situation becomes a medical emergency. This may not be a topic people discuss openly, but understanding it early can make a major difference in long-term digestive health and daily quality of life. To understand why this problem becomes so uncomfortable and difficult, we first need to understand what is actually happening inside the body. A fecal impaction is not simply being constipated. It is a condition where stool becomes so dry, compacted, and hardened inside the rectum or lower colon that the body can no longer move it out normally. Under healthy conditions, the colon works like a slow-moving conveyor system. Muscular contractions called peristalsis gently push waste through the intestines while the body absorbs water and nutrients along the way. Normally, stool remains soft enough to move comfortably through the final portion of the digestive tract and leave the body without excessive strain. But when stool moves too slowly, the colon continues pulling more and more water out of it. Over time, what was once soft gradually becomes dense, dry, and difficult to pass. If this process continues for several days, the stool can eventually collect in the rectum and form a large, hardened mass. This is where many people begin noticing pressure, bloating, heaviness, or the constant feeling of needing to use the bathroom without relief. Some people spend long periods sitting on the toilet trying repeatedly to pass stool, only to feel exhausted afterward with little progress. The body keeps signaling that something needs to come out, but the blockage has become too firm for normal muscle contractions to move effectively. Aging changes this process significantly. As adults grow older, intestinal movement naturally slows down. The muscles inside the colon become less active, and nerve communication becomes less efficient. Many older adults also drink less water without realizing it, because the sensation of thirst weakens with age. On top of that, common medications used for blood pressure, pain management, allergies, iron deficiency, or depression may further slow bowel activity. Reduced movement also plays a major role. Walking and daily physical activity help stimulate intestinal motion. When mobility decreases due to arthritis, surgery, recovery, fatigue, or long periods of sitting, the digestive system often slows down as well. Over time, stool may remain trapped in the lower colon long enough to become extremely dehydrated. In severe cases, the rectum stretches beyond its normal capacity trying to hold the hardened mass. This can create discomfort not only in the digestive tract, but also pressure on nearby pelvic organs such as the bladder. One of the most confusing parts of fecal impaction is that some people may still experience loose watery leakage around the blockage. Because liquid stool can sometimes pass around the hardened mass, many assume they are dealing with diarrhea instead of severe constipation. In reality, the solid blockage may still remain firmly stuck inside the rectum. This is why understanding the mechanism matters so much. Fecal impaction is not simply inconvenience. It is a mechanical blockage developing gradually inside a digestive system that has slowed down over time. Have you ever felt pressure in your lower stomach, sat in the bathroom for nearly an hour, and still walked away feeling like your body refused to cooperate? For many older adults, this experience is quietly becoming more common, yet very few people talk about it openly. What seems like ordinary constipation can sometimes become something far more serious, a condition called fecal impaction, where stool becomes so dry and compacted that the body can no longer remove it naturally. The danger is that this problem usually develops slowly. A few missed bowel movements turn into several days. Water continues to leave the stool while it sits inside the colon, causing it to harden more and more over time. Eventually, the rectum becomes blocked by a dense mass that creates constant pressure, discomfort, bloating, and exhaustion from repeated straining attempts that lead nowhere. What makes this especially concerning after age 60 is that the digestive system naturally changes with aging. The muscles of the colon contract more slowly, nerve signaling becomes less efficient, and many common medications can further reduce bowel movement activity. At the same time, older adults often drink less water without realizing it because the sensation of thirst becomes weaker with age. All of these factors combine to create the perfect environment for stool to remain in the colon too long and gradually harden. The colon itself is designed to absorb water from waste as it moves through the digestive tract. Under healthy conditions, this process keeps stool soft enough to pass comfortably. But when movement slows dramatically, the colon keeps removing moisture from the same material day after day. What began as normal waste can eventually transform into a dry, rigid mass that the rectum struggles to expel. Many people do not recognize the warning signs early enough. They may notice bloating, reduced appetite, lower abdominal heaviness, or the constant feeling of needing to use the bathroom without success. Some even experience leakage of liquid stool around the blockage and mistakenly assume they have diarrhea instead of severe constipation. This confusion often delays treatment and allows the impaction to worsen further. Understanding what fecal impaction actually is changes everything. This is not simply an uncomfortable inconvenience. It is a mechanical blockage inside the body that places stress on the digestive system, surrounding organs, and overall health. The earlier it is recognized, the easier it becomes to manage safely and prevent from returning in the future. One of the most confusing and overlooked signs of fecal impaction is something doctors sometimes call overflow diarrhea. Many older adults become alarmed when they suddenly notice loose, watery stool leaking unexpectedly, especially after several days of constipation. Naturally, they assume the body is finally emptying itself or that they have developed diarrhea, but in some cases, the opposite is actually happening. When a hard, dehydrated mass becomes stuck deep inside the rectum, the blockage prevents normal stool from passing normally. However, the intestines higher up in the digestive tract continue producing liquid waste and digestive fluid every day. Since the solid mass blocks the main exit, thinner liquid begins slowly leaking around the sides of the obstruction. This creates the appearance of diarrhea even though a severe blockage is still present underneath. This misunderstanding can become dangerous because some people take anti-diarrheal medication, believing they need to stop the loose stool. But slowing the intestines further may worsen the blockage and increase pressure inside the colon. That is why persistent watery leakage combined with bloating, pressure, or incomplete emptying should never be ignored, especially in older adults. Another hidden complication involves the bladder. The rectum and bladder sit very close together inside the pelvis. When the rectum becomes overly stretched by a large impacted mass, it can physically press against the bladder and surrounding urinary structures. Many people suddenly notice difficulty urinating, weak urine flow, pelvic pressure, or the constant urge to urinate without relief. Some older adults even believe they have developed a urinary infection overnight, when the real cause is pressure coming from the impacted rectum behind the bladder. In women, this pressure may feel even stronger because of pelvic anatomy and reduced pelvic floor support with age. These symptoms may feel embarrassing to discuss, but they are important warning signals from the body. Recognizing them early can help prevent more serious complications and allow treatment before the situation becomes an emergency. Fecal impaction can happen at almost any age, but the risk rises dramatically after 60 because several changes begin happening inside the body at the same time. Most people assume constipation is caused by only one issue, such as not eating enough fiber. In reality, aging affects nearly every system involved in healthy bowel movement function, and these small changes slowly build on each other over time. One of the biggest factors is slower intestinal movement. The colon depends on rhythmic muscular contractions called peristalsis to push waste forward through the digestive tract. In younger adults, these contractions usually happen efficiently and automatically. But with aging, the muscles of the colon gradually lose strength and coordination. Nerve signals also become slower and less responsive. As a result, stool remains inside the colon longer than it should, allowing more water to be absorbed out of it day after day. Hydration becomes another major issue. Many older adults live in a state of mild chronic dehydration without fully realizing it. The natural sensation of thirst weakens with age, meaning the body may need water even when a person does not feel thirsty. At the same time, some seniors intentionally drink less fluid because they worry about frequent urination or waking during the night. Unfortunately, reduced fluid intake causes stool to become drier, firmer, and more difficult to pass naturally. Mobility also plays an enormous role. Walking and daily movement mechanically stimulate the digestive tract. Even gentle activity helps encourage healthy bowel contractions and keeps intestinal contents moving consistently. But after retirement, surgery, arthritis, falls, joint pain, or long periods of sitting, physical movement often decreases significantly. Without regular movement, the colon tends to slow down even further. Medication side effects are another hidden contributor. Many of the most commonly prescribed medications for older adults can reduce bowel motility. Pain medications, iron supplements, calcium supplements, antihistamines, antidepressants, blood pressure medications, and some sleep aids may all increase constipation risk. Individually, the effect may seem small, but when several medications are combined together, the digestive slowdown can become substantial over time. Dietary habits often change as well. Appetite may decrease with age, leading many seniors to eat smaller meals with less fiber and lower moisture content. Some rely heavily on processed convenience foods that contain little natural fiber. Others avoid certain fruits or vegetables because of dentures, chewing difficulty, or digestive discomfort. These adjustments may unintentionally reduce stool bulk and make bowel movements less regular. Another overlooked factor is delayed bathroom habits. Many people repeatedly ignore the urge to use the bathroom because they are busy, traveling, or uncomfortable using public restrooms. Over many years, this can reduce rectal sensitivity and weaken the body's natural elimination signals. The longer stool sits inside the rectum, the harder and drier it becomes. What makes fecal impaction especially concerning in older adults is that the warning signs may appear slowly and quietly. Fatigue, bloating, appetite loss, abdominal heaviness, or urinary pressure are often mistaken for normal aging instead of digestive dysfunction. By the time severe discomfort appears, the blockage may already be advanced. The good news is that understanding these risk factors creates an opportunity for prevention. Small daily habits such as hydration, movement, regular meal timing, fiber intake, and medication review can make a major difference in protecting long-term digestive health after 60. If you are dealing with symptoms that strongly suggest fecal impaction, the most important thing is to stay calm and avoid making the situation worse through aggressive straining. Many people instinctively believe they simply need to push harder, but a hardened blockage inside the rectum often does not respond to pressure the way normal stool does. Excessive straining may increase irritation, worsen hemorrhoids, create small tears around the anal tissue, and place unnecessary stress on the cardiovascular system, especially in older adults with high blood pressure or heart conditions. The first step is recognizing when normal constipation may have progressed into something more serious. Warning signs can include several days without a complete bowel movement, persistent rectal pressure, bloating, lower abdominal heaviness, leakage of watery stool, difficulty urinating, nausea, or the constant sensation that stool is present but unable to pass. Once these symptoms appear, hydration becomes extremely important. Small, steady amounts of water throughout the day may help soften stool naturally over time. Warm fluids such as herbal tea or broth may also help stimulate digestive movement more gently than cold beverages. However, drinking large amounts of water all at once is usually less helpful than consistent hydration across several hours. One of the most commonly recommended early interventions is a glycerin suppository. Glycerin works by drawing moisture into hardened stool while also lubricating the rectal area to make passage easier. Proper positioning matters. Lying on the left side with knees slightly bent follows the natural curve of the lower colon and may improve effectiveness. After insertion, remaining still for at least 30 minutes gives the suppository time to work gradually. Many people become impatient and attempt to force a bowel movement too early before softening has fully occurred. Gentle movement afterward may also help stimulate bowel activity. Slow, walking around the home for several minutes can encourage natural intestinal contractions without placing excessive strain on the body. If the first attempt does not produce significant results, repeating the process later may sometimes help soften the outer layers of the blockage further. If symptoms continue, some healthcare professionals may recommend a warm water or saline enema according to product instructions and medical guidance. The goal is to introduce moisture into the lower bowel gradually and safely. Patience is important because forcing rapid evacuation attempts may increase discomfort and irritation. At the same time, there are several things people should avoid. Anti-diarrheal medication should generally not be used when overflow leakage may actually be caused by a blockage. Stimulant laxatives taken repeatedly without medical guidance may also create excessive intestinal stress without resolving the hardened mass itself. Strong pushing or repeated prolonged straining sessions are rarely helpful and may increase exhaustion and tissue irritation. There are also situations where medical evaluation should not be delayed. Severe abdominal swelling, inability to pass urine, vomiting, fever, significant weakness, dizziness, rectal bleeding, or persistent pain deserve professional attention promptly. If at-home measures fail after reasonable attempts, seeking urgent medical care is the safest decision, not a sign of failure. In a medical setting, clinicians have access to stronger therapeutic enemas, imaging tools, and professional procedures designed specifically for severe impaction. Sometimes the blockage extends higher into the colon than expected, requiring more advanced treatment approaches. In some cases, trained medical professionals may need to manually break apart and remove hardened stool safely using lubrication and specialized techniques. While this sounds uncomfortable, many patients experience enormous relief afterward because pressure inside the rectum and colon is finally released. Recovery afterward is equally important. The rectal tissue may remain irritated and sensitive for a short time. Warm sitz baths, soft high-fiber foods, hydration, and avoiding heavy straining can help the tissue recover more comfortably. Oatmeal, soups, cooked vegetables, bananas, and water-rich foods are often easier on the digestive system during the first couple of days. Most importantly, the episode should become a turning point rather than an isolated crisis. Reviewing medications with a doctor, improving hydration habits, increasing daily movement, and building a consistent bathroom routine may greatly reduce the chance of recurrence. Many people wait until severe discomfort appears before paying attention to bowel health, but the digestive system usually gives smaller warning signs long before an impaction develops. The goal is not simply short-term relief. The real goal is restoring healthy bowel patterns early enough that the body no longer reaches this level of blockage again. When fecal impaction becomes too severe to manage safely at home, hospital treatment may become necessary. This usually happens when the blockage has remained in place for many days, symptoms continue worsening, or the person develops complications such as severe abdominal pressure, urinary difficulty, dehydration, vomiting, or significant weakness. Seeking medical care at this stage is not overreacting. It is often the safest way to prevent further stress on the digestive system and surrounding organs. In the hospital, doctors first evaluate how extensive the impaction has become. They may perform a physical examination, review symptoms carefully, and sometimes use imaging such as abdominal X-rays or CT scans to determine whether the blockage is limited to the rectum or extends higher into the colon. This information helps guide the safest treatment approach. Many patients begin with medical-grade enemas designed to soften and hydrate the impacted stool more effectively than over-the-counter products. These solutions are administered carefully while monitoring the patient's comfort and hydration status. In some cases, repeated treatments combined with fluids and observation allow the hardened mass to break apart gradually and pass naturally. However, long-standing impactions sometimes become too dense and compacted to respond fully to these measures alone. When this happens, physicians may perform a procedure called manual disimpaction. Although the name sounds intimidating, it is a well-established medical technique used specifically for severe rectal impactions. During the procedure, a trained healthcare professional carefully uses lubrication and gentle manual techniques to gradually break apart and remove portions of the hardened stool. Because the surrounding rectal tissue is often inflamed and sensitive after prolonged pressure, patient comfort becomes a major priority. Depending on the situation, sedation, local anesthesia, or pain management may be provided to help reduce discomfort during the process. Many people feel embarrassed discussing this procedure, but doctors and nurses treat it as a routine medical condition, especially in older adults. In fact, one of the most common reactions afterward is relief. Once the pressure inside the rectum and lower colon is finally reduced, patients often notice immediate improvement in bloating, pelvic discomfort, urinary pressure, and exhaustion. Hospital treatment also provides an important opportunity to identify the underlying causes that allowed the impaction to develop in the first place. Medication side effects, dehydration, reduced mobility, chronic constipation, low fiber intake, or underlying digestive disorders can all be reviewed before discharge so future episodes become less likely. Once a fecal impaction has been successfully cleared, the body usually needs a short recovery period before digestion feels completely normal again. The rectal tissue may remain irritated, swollen, and sensitive for several days because of the prolonged pressure and repeated straining that occurred before treatment. Mild soreness, temporary discomfort while sitting, or a feeling of heaviness in the lower abdomen is fairly common during this stage. Hydration becomes especially important after recovery begins. Drinking water steadily throughout the day helps restore normal moisture balance inside the colon and reduces the chance of stool hardening again too quickly. Warm soups, herbal teas, cooked vegetables, oatmeal, bananas, and soft, high-fiber foods are often easier on the digestive system during the first few days. Many doctors also recommend gentle movement as soon as possible. Short walks help stimulate intestinal contractions naturally and encourage the digestive tract to regain a healthier rhythm. Long periods of sitting or lying down may slow recovery further. This is also the ideal time to review long-term habits. Medication side effects, low fiber intake, dehydration, and irregular bathroom routines often contribute to impaction over time. Addressing these factors early can help prevent future episodes before they begin quietly building again. Most importantly, recovery should not feel embarrassing. Digestive problems become increasingly common with age, and paying attention to bowel health is a normal part of protecting long-term wellness and independence. The most effective treatment for fecal impaction is preventing it from happening in the first place. Once someone experiences severe constipation or rectal blockage, the goal should not only be short-term relief, but building daily habits that keep the digestive system moving consistently for years to come. Fortunately, prevention often depends on simple routines repeated steadily over time rather than extreme diets or complicated treatments. Hydration is one of the most important foundations. The colon naturally removes water from waste as stool moves through the digestive tract. When the body is dehydrated, the colon pulls out even more moisture, causing stool to become dry, hard, and difficult to pass. Many older adults underestimate how much fluid the body still needs with age, especially because the sensation of thirst weakens over time. Drinking water regularly throughout the day is far more effective than waiting until dehydration appears. Warm herbal teas, broth-based soups, and water-rich fruits may also help support healthy hydration. Fiber is another key part of long-term bowel health. Soluble fiber absorbs water and helps create softer, bulkier stool that moves more comfortably through the intestines. Foods such as oatmeal, beans, lentils, berries, apples, cooked vegetables, and whole grains may help support more regular bowel movements. However, increasing fiber too quickly without enough water can sometimes worsen bloating and discomfort, so gradual changes tend to work best. Movement matters more than many people realize. The digestive tract responds strongly to physical activity because movement stimulates intestinal contractions naturally. Even gentle walking after meals may help encourage bowel activity. For older adults with limited mobility, light stretching, chair exercises, or swimming can still provide important digestive benefits. The goal is consistency, not intensity. A regular bathroom routine is equally important. The body functions best with predictable rhythms. Many gastroenterologists recommend sitting on the toilet around the same time each morning, especially after breakfast, when the digestive system naturally becomes more active. Using a small footstool under the feet may also help place the body in a more natural elimination position by relaxing the pelvic muscles slightly. One of the most important habits is avoiding the repeated urge to hold it. Ignoring bowel signals over time can reduce rectal sensitivity and train the body to delay elimination longer than it should. The longer stool remains in the colon, the harder it usually becomes. Medication review is another valuable step for older adults. Many commonly used prescriptions contribute to constipation gradually over time. Discussing side effects with a doctor or pharmacist may help identify safer alternatives or supportive strategies before severe constipation develops. Most importantly, prevention should focus on steady habits instead of quick fixes. The digestive system responds best to routine, hydration, movement, balanced nutrition, and patience. Small daily actions may not feel dramatic in the moment, but over months and years they can make an enormous difference in maintaining comfort, independence, and long-term digestive health. If today's video helped you better understand what your body may be trying to tell you, remember this: digestive problems are common with aging, but suffering in silence should never feel normal. Small daily habits like hydration, movement, balanced meals, and listening to your body early can make a meaningful difference over time. And most importantly, there is no shame in talking about digestive health. The sooner problems are recognized, the easier they often are to manage. If you found this video useful, subscribe to the channel for more science-based videos on healthy aging, digestion, and longevity. And let me know in the comments, have you or someone you know ever experienced symptoms like these?